Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Telbivudine. Its brand name is Sebivo. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action, or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Telbivudine to a patient. We'll then touch on examples of dosing, and then finish it off with side effects with percentages. I put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So Telbivudine is a synthetic thymidine nucleoside analog. It has activity against hepatitis B virus by competitive inhibition of viral DNA polymerase. It should be noted that it is not active against human cellular DNA polymerases. In terms of indications or reasons we would prescribe this medication to a patient, we would often see this medication used in the treatment of chronic type B viral hepatitis. With respect to contraindications or reasons we would not be able to prescribe Telbivudine, well, first of all, we wouldn't give this medication to a patient who had a hypersensitivity to Telbivudine or to any other component of the formulation. This medication would be contraindicated to be used with pegylated interferon alpha 2A due to an increased risk of peripheral neuropathy. Now for some examples of dosing with Telbivudine. So in the treatment of chronic type B viral hepatitis, we would typically see 600 milligrams orally once daily. Now in the off-label dosage for prophylaxis for perinatal transmission in chronic type B viral hepatitis, we would again see 600 milligrams orally once daily, but this time they would start the medication at 28 weeks gestation and discontinue at postpartum week 4. Again, like I said, this is an off-label indication. As with all medications, there are some side effects or adverse reactions that patients may experience while using Telbivudine. We'll go over some of those here now. Some patients may experience an increased creatine kinase level. That happens about 11% of the time. About 10% of patients may experience a headache, and 6 to 16% of patients may experience a cough. Fatigue seems to come in between 13 and 18%, and influenza between 18 and 21%. Now, two more serious side effects would be lactic acidosis or rhabdomyolysis. Alright everybody, that's all we're going to talk about today with Telbivudine. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. And there's also some links in the description you can check out as well. So for today, take care.